Today, we're talking about Isopto Atropine Drops. These drops are used before eye examinations, like refraction, and to treat certain eye conditions, such as uveitis. They belong to a class of drugs known as anticholinergics, and they work by widening, or dilating, the pupil of the eye. It's important to use these drops as directed by your doctor to get the best results. Typically, the recommended dosage is 1 to 2 drops in the affected eye, 2 to 3 times a day. It's best to use them at the same time every day to help you remember. Always follow your doctor's instructions for the best outcome. When using Isopto Atropine Drops, it's important to wash your hands before applying the drops to avoid contamination. If you wear contact lenses, make sure to remove them before using the drops and wait at least 15 minutes before putting them back in. To apply the drops, tilt your head back, look upward, and pull down the lower eyelid to make a small pocket. Then, hold the dropper directly over your eye and place 1 drop into the pocket. After applying the drop, gently close your eyes for 1 to 2 minutes and apply gentle pressure at the corner of your eye for 2 to 3 minutes to prevent the medication from draining out. Try not to blink or rub your eye. If directed, repeat these steps for your other eye or for more than 1 drop. Usually, Isopto Atropine Drops are used 2 to 4 times daily, as directed by your doctor. Remember not to rinse the dropper and to replace the dropper cap after each use. If the solution turns brown or cloudy, or contains particles, do not use it. If you are using other eye medications, wait at least 5 to 10 minutes before applying Isopto Atropine Drops, and use eye drops before eye ointments to allow the drops to enter the eye. To get the most benefit from Isopto Atropine Drops, use it at the same times each day and do not miss any doses. Use it for the full time prescribed, and inform your doctor if your condition does not improve or worsens. If you experience any burning, stinging, redness, or temporary blurred vision in your eyes while using Isopto Atropine Drops, it is important to inform your doctor or pharmacist. This medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. While many people do not experience serious side effects, it is important to seek medical attention if you experience dizziness, fainting, changes in eye pressure or pain, shallow breathing, or changes in mental or mood. Additionally, if you notice symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Isopto Atropine Drops, make sure to inform your doctor or pharmacist about any allergies you may have to atropine, belladonna alkaloids, or any other allergies you may have. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so it's important to speak with your pharmacist for more information. Before using this medication, be sure to inform your doctor or pharmacist about your medical history, especially if you have a personal or family history of glaucoma, Down syndrome, or any brain damage or spastic paralysis, particularly in children. After applying the drops, your vision may become temporarily blurred. It's important not to drive, use machinery, or engage in any activity that requires clear vision until it is safe to do so. This medication may also make your eyes more sensitive to light, so it's important to protect your eyes in bright light and use dark sunglasses when outdoors. It's important to note that infants or small children may be more sensitive to the side effects of this drug, so be sure to keep the medication out of their reach and wash your hands after each use. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. If you are breastfeeding, it is unknown if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding while using Isopto Atropine Drops. When using Isopto Atropine Drops, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. To ensure your safety, keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without the approval of your doctor. This will help to prevent any potential complications and ensure that the medication is effective in treating your condition. If someone accidentally swallows Isopto Atropine Drops, it can be harmful. If an overdose occurs and serious symptoms such as passing out or trouble breathing are observed, it is important to seek immediate medical assistance by calling 911 or a poison control center. Symptoms of an overdose may include flushed or dry skin, fast or irregular heartbeat, fever, mental or mood changes such as hallucinations, and loss of coordination. This medication is only for use in the eyes. Do not share it with others. If you forget to use Isopto Atropine Drops on your regular schedule, just use it as soon as you remember. But if it's almost time for your next dose, then just skip the missed dose and use your next one at the regular time. Don't use double the dose to make up for the missed one. When using Isopto Atropine Drops, it's important to store them according to the instructions on the product package or as advised by your pharmacist. Keep all medications out of reach of children and pets. If you are using single-use containers, make sure to throw away any leftover medication after use. It's crucial to properly dispose of this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.